As scientists explore COVID-19's lasting effects and the obstacles patients face in recovery, doctors find themselves helping patients through new conditions caused by the virus's effect on the brain. Angela McCall has a closer look tonight.
Dr. Wong is a rehabilitation doctor at Mary Free Bed, who tells us the road to recovery is long for patients with conditions COVID-19 can worsen and those it can create.
When they come to us, let's say they're at a 0 and 10 is like normal, they're usually leaving at like 4 or 5. So they still have a long ways to go, unfortunately, for their recovery.
If that wasn't enough, COVID causes neurological problems.
Just with COVID, you have low oxygen levels for a sustained amount of time, which can cause what we call an anoxic brain injury, which is kind of like a mini stroke.
Brain injuries from COVID-19 can leave patients feeling foggy and fighting serious mental health issues they never had before, like anxiety and depression.
The brain chemistry has actually been altered because of COVID, and so we do find people needing antidepressants, at least for a temporary amount of time.
Mary Free Bed is focusing on what they can do for post-COVID patients now.
Time and therapy both help. Certainly, therapy will kind of accelerate the healing. So with cognitive challenges, especially in the hospital, we do have our speech are actually cognitive therapists, and they help with some of the retraining as far as focus and attention. And for the mood aspect, if it's severe, certainly we'll have psychologists who help with that component.
Offering COVID-19 recovery clinics, helping anyone, not just those hospitalized by the virus, needing help with their post-COVID symptoms.
I think for certainly with the post-COVID syndrome, if you do, there's significant problems. And as health professionals, we're recognizing it ourselves. And we've built actually teams around for post-COVID syndrome, and others hospitals have probably around the country, because this is something we are recognizing as a new disease that needs paying attention to.
In Grand Rapids, Angela McCall, Fox 17 News.
The clinics offered by Mary Free Bed are available for anyone needing help with long-term symptoms, including cognitive therapies and physical therapies, even if they weren't hospitalized for the virus. Still to come tonight, a popular winter pastime, especially right here in Michigan. But as fun as sledding is, especially right now when there's not other things to do, it can also still come with risks out there. What doctors say to do to help keep your kids on the slopes and out of the hospital.
Could have some slick spots out there early tomorrow morning, Derek, because of this winter weather advisory. Not a big system, but some freezing drizzle. We've got to talk about Maine weather segments. Stay put, folks. It's coming up after the break.
Well, a lot of people do it in the winter, especially this time of year when there's not much else to do with COVID, but it also can lead to trips in the emergency room. Of course, talking about sledding, Deanna Falzone has a look at how to prevent injuries while going downhill.
When the snow falls, the sleds come out and ER visits go up.
We just want to make sure that they are aware of the risks and to make sledding as safe as possible.
That's why Rebecca McAdams with Nationwide Children's Hospital co-authored a study published in the Clinical Journal of Sports Medicine, collecting data from the National Electronic Injury Surveillance System. The researchers estimated more than 220,400 patients went to the emergency room after being hurt while sledding between 2008 and 2017. Nearly 70% were 19 or younger, most hurt in a collision.
They were falling off the sled and hitting the ground, or they were also hitting into a person.
McAdams says many of those were head injuries, but you can lessen your risk of getting hurt by wearing a helmet, picking a sled that you can control, one that can be steered or stopped, checking your surroundings, making sure the area is obstacle-free, by having an adult present to make sure everyone is staying safe, and don't use a motorized vehicle to pull a sled.
Most times people were actually colliding into the ATV itself, and a lot of those people had head injuries, and 3/4 of those people were actually children.
So have fun in the snow, but stay safe.
Deanna Falzone, Fox 17 News.
Researchers say the number of sledding injuries in the ER has decreased over the time period they were studying, but they say that may mean more people are possibly seeking care elsewhere, like in urgent care, or calling their doctor directly. And as we were talking about during the story, more snow, Anthony, a little more powdery, less dirt, less chance of getting tossed. We could use some more snow for safer sledding, actually.
Hey, we have not had much,
No.
That's for sure. And the snow we had last week, Derek, I was just looking at it on this tower cam that in between the roadways, the highways, there's a lot of grass showing up once again. In certain locations, there's quite a bit of snow still out there, but you need to get that fresh snow every so often to freshen up the snowpack. Certainly, we haven't been doing that because we're running 30 inches below where we should be for this time of year. Let's take a look at the updated statistics. Not quite 30 inches, but very close, and it will be there once we get to January 12th, just a couple hours away. The average snow through January 11th, 37.1 inches in GR. We've gotten 7.5. Last year at this time, we had received 21.9 inches. So I think most of us, thinking back at last year, and it was pretty much a non-winter by the standards of maybe what we thought of years back, decades back, and even much lesser than that this year. Record through January 11th, 88.2 inches from 1952, folks. So a far cry from that. And I'm going out the next several days. This is actually through Sunday at 6 p.m. So about 6 days out from now, projected snow off the GFS model. If you know anything about weather forecasting, this is just a general look. This is not the be-all, end-all, but I do think there is going to be an opportunity for some light accumulations of snow through the day, Friday into Saturday and Sunday. The specifics on that, not particularly clear right now. Probably the best chance is going to be Saturday or Sunday, where the temps start to get cold enough indeed for any light accumulations. We are not talking about any big systems, no big snowstorms anytime soon here within West Michigan. In fact, overnight tonight, it's all about the freezing mist that is to start coming about here late evening. And for the overnight mist or drizzle, folks, this is a very minor element on the weather maps, but we do have a winter weather advisory from the National Weather Service. More details on that in a second. Near 40 degrees, though, Wednesday and Thursday. And then the next system does arrive late Thursday, perhaps as early as late afternoon or evening sometime, with patches of drizzle, rather weak for us. A rain shower later at night Thursday could transition to a few rain and snow showers Friday, and then transitioning more so to plain flurries and snow showers Saturday, Sunday into Monday as an upper level low just spirals over the region. But look at this. I mean, it's just not that cold. We're going to be pushing our way well into mid-January by the end of that 7-day stretch, and still no major Arctic outbreaks. And I don't see it for quite some time, though the back half to this month, yes, as I've been talking, likely will be chillier than the first half. Still no obvious thoughts that we're going to get slammed with very cold weather. Let's go to first things first, though. We've got these purple boxes, the purple counties, and that's where the winter weather advisories did officially go into effect at 8 o'clock, but the atmosphere pretty dry right now. There is some freezing mist and drizzle out over Lake Michigan, not being detected as typically is the case. You don't really get it showing up on the radars, so you've got to go to the very sensitive radars, which does not show up on the ones we have on this system. So you can't anticipate some damp pavement if you're out in the overnight for whatever reason, or up very early heading off to work. Look out. There could be some slippery stretches. Temperatures running in the upper 20s to around 30 degrees. Right along the lakeshore, though, we're already near the freezing mark, if not a degree or two higher. So I think the effects are very minimal, probably not any in the Muskegon area and sections nearby there. But once you get inland, it is colder, and I do think there will be some slippery spots. Look at all the clouds, though, through tomorrow. As we get into Wednesday, it's still going to be mainly cloudy around here. I don't see much prospect for sunshine, Derek, right through this 7-day. But the good news is that if you don't want the big snows, I don't have that either. Here comes the system on Thursday, late day into the evening, maybe a shower or two. It's mainly just a big circulation that's going to have some hit and miss snow showers. This is the European model. The representation of the snow looks really widespread and somewhat ominous, but it's really going to be hit and miss, just spotty activity right through the weekend. We'll see how it plays out, though. Sometimes the upper level lows, Derek, can throw down a heavier burst of snow here or there that you kind of got to nowcast it with. We'd never be able to predict that out this far out. Some light accumulations, though, on the table through the weekend. I'll have more coming up in just a bit.
All right, Anthony, thank you for that. President Trump now banned from Twitter and Facebook, but not everyone on board with that decision.
They certainly can do this. Twitter, Facebook, Google, these are all private companies. And as private companies, they can do what they want.
But for some, the question remains, should they be doing it? Up next, how experts explain the difference between ethical and constitutional. Well, Citigroup and JP Morgan have both announced they will stop political donations from any party following the riots in D.C. last week. JP Morgan says for at least the next 6 months that money will be turned down, and other companies like Marriott International and Blue Cross Blue Shield are doing the same. They have stopped donating to Republican lawmakers as well who oppose certification of President-elect Joe Biden's victory. President Trump's social media accounts, meanwhile, are gone for good. Twitter said they removed him, citing the risk for violence. Reporter Jennifer Ann Wilson taking a deeper look into the concerns of free speech and public safety.
In the midst of the violence in Washington, D.C. on Wednesday, President Trump tweeted. Twitter added warning labels, then citing concerns about incitement of violence. The social media platform permanently suspended President Trump's account, raising questions and concerns.
There are separate questions about whether they can do this and whether they should do this.
John Malcolm is the vice president of the Heritage Foundation, a conservative think tank. He's also director of their Center for Legal and Judicial Studies.
They certainly can do this. Twitter, Facebook, Google, these are all private companies. And as private companies, they can do what they want.
But should they? In real life, if you were to see a caution sign on the playground, you'd obviously choose the swing without the warning. Now, some people would say that this sign is biasing you against this swing, while others say it's keeping you safe. But to just remove the swing altogether removes your ability to choose for yourself, and perhaps you'd never know it was there at all.
We are in a democratic crisis, and it's pretty clear the president is fueling that crisis. And so from that perspective, his being deplatformed is a good thing for democracy.
John Pasek is associate professor of political science at University of Michigan.
The idea of deplatforming people should make us a little bit uneasy.
If you can ban the speech of the president, you can certainly cut off the speech of all kinds of conservatives. And so, that is certainly not a decision which should be taken lightly.
Where is the line between dialogue and public safety? And should social media companies be the ones to draw it?
Dangerous stuff can happen from speech on social media. And they do have a responsibility for the fact that that is being broadcast. On the other hand, the idea of putting companies in the role of trying to police this is absurd.
Yet no one wants the government to police social media platforms either. Malcolm points to personal responsibility.
I certainly hope that people, when they see some of the consequences that have resulted from bad uses of social media, step back and say, whoa, is this really where we want?
He says he hopes tech companies examine their actions and whether or not this time they may have taken things too far.
That was Jennifer Ann Wilson reporting. An exciting day here in Michigan when sports betting became legalized, but we're still waiting on an exact rollout date for the next phase, online betting.
There's a lot of pent-up demand for sports betting. I think the handle here is going to be comparable with